So standing here, I am filled with pride, not only as a representative of the Minister of Health, but also an alumnus and a long-standing partner of this great institution. The story of the School of Public Health is woven into the fabric of Uganda public health history, which we've just listened to. It's defined by the resilience and innovation and enduring commitment to make health services accessible to all Ugandans and beyond. The school has constantly stood at the forefront of the health research, policy development, and health workforce training. And as you clearly saw that the Minister of Health is one of the greatest employer and beneficiary of this critical human resource. Its policies and advanced groundbreaking research that has saved countless lives is also a story of partnerships that have transcended institutional boundaries, which is driven by a shared vision of a better health for all. The partnership between the Ministry of Health and Makerere School of Public Health has been one of mutual growth, shared learning, and impactful actions. Together we have implemented programs that have reshaped the Ugandan health sector and enhanced the service delivery across the country. I have myself worked closely with the school on various research and health system strengthening interventions, and I know many of them across the sector. I will not definitely be able to list all of them, but allow me to give a few examples. Monitoring and evaluation technical support, the MEDS program in partnership with Ministry of Health and the Centers for Disease Control, Prevention, and the University of California. The institution aims to improve HIV quality and the strategic information which has been highlighted by the representative of His Excellency, the Ambassador of the United States, through enhanced information system and data utilization. If we have to change anything, then it means that we have to start from the data, and that's key. The other key area where we work together is our area of performance monitoring for action. And the school has been in the forefront of family planning research, using performance information for action surveys to gather critical data which informs national policies. We've been able to look at areas of equity, and so that we are able to identify who are the people whom we are leaving behind, and then we'll be able to plan. This has been part of the research for scalable solutions, and this has been able to inform our implementation plan 2, which is running from 2025. Partnership in data-driven decision making. This initiative, the Minister has worked significantly to strengthen data-driven decision making in the area of HIV, TB, and malaria programming, ensuring that national health programs are guided by evidence based on strategies, so that resources are invested in areas where you can be able to have greatest impact. We've also worked in the area of the human harmonized health facility assessment. This is as just recent as March 2024. In partnership with the Ministry of Health, we have conducted the first harmonized health facility assessment, setting a new benchmark for evidence-based planning and service delivery in this country. There are quite many of them that I would want to stop there. You know, speaking of a story of a 70-year is not very an easy task, and it would have been a book of its own. So as I conclude, and as we launch the 2025-2030 strategic plan, the Ministry of Health reaffirms the commitment in supporting Makerere School of Public Health mission And we believe that this plan will further strengthen our collaboration and joint commitment to further enhance health systems, promote health equity, build local capacity to address emerging public health challenges, but at the same time, as we manage the epidemics and outbreaks, ensure that we are cognizant of continuity of all the other essential health services. So 70 years is a remarkable achievement, and on behalf of the Minister of Health, I extend my warmest congratulations to Makerere School of Public Health for its unwavering commitment for advancing public health in Uganda and beyond. The Minister of Health looks forward to deepening this partnership as we continue working towards a healthier future for all. I want to end by thanking all those who have supported this initiative, and I must say that let's still work much better in the next 50 to 100 years. Thank you very much for listening, for God and my country.
And representing the World Health Organization, the Technical Officer for Health Financing, Ms. Christabel Adewe. Most welcome.
Thank you, and good afternoon, everyone. I also bring sincere apologies from the WHO representative, Dr. Charles Njuguna, who has a really good reason for not being here. He's away in Lyon, in France, representing Uganda in a global meeting. Okay, so our chief guest, the State Minister for Primary Health Care, the Director General Minister of Health, the Vice Chancellor, Makerere University, the Chairperson, Makerere University Council, the Dean of School of Public Health, past deans and directors, esteemed faculty of Makerere University, distinguished alumni, the U.S. government representative, health development partners present, members of the Fourth Estate, distinguished ladies and gentlemen. It's truly a great honor for me to stand before you today on behalf of the World Health Organization. As we celebrate this momentous occasion, the 70th anniversary of the School of Public Health, this is not just a milestone for this institution, but the entire public health community in Uganda, Africa, and beyond. I really thank Professor Wabwire for that nostalgic and rich journey, which really helped us appreciate how far the school has come. So since its establishment, of course, the school has been at the forefront of education, of research, of practice in public health. And it has produced very outstanding health professionals, which our agency has been very fortunate to rely on, especially for disease outbreaks. And of course, we cannot overestimate or overstate the role that the School of Public Health has played in shaping the health landscape in Uganda. Its graduates have led initiatives in disease control, in maternal and child health, in HIV prevention. I mean, the RACI project is quite outstanding. It's been really pivotal in Uganda's ongoing efforts to achieve universal health coverage, which is the area I support at my workplace, and I've really benefited from the strong collaboration that we have with the School of Public Health. So at the World Health Organization, we've long recognized the school's immense contributions to the field of public health for the decades that we've worked together. And I think it's really an outstanding example, or a shining example of what's at the intersection of academia, governments, and its international organizations. When we come together to achieve a common goal, we can really, really go a long way. And while we've worked together for so many decades, since 2019, we signed an official MOU with the School of Public Health to implement several joint projects in various areas, including communicable and non-communicable diseases, in health system strengthening, and several others. And through this agreement, Makerere has continually committed to sharing information, to support training, to generate research, to strengthen networks and opportunities between our respective institutions. This collaboration has generated a lot of evidence which complements the support that we provide to our member state here in Uganda, but also in the global health arena. And I don't want to deliberate a lot on the specific activities, but just within the last 5 years, we've had close to 50 projects together with the School of Public Health, and that's very outstanding. And it's really congratulations to the school that you're now an independent school. A standalone. I'm sorry, a standalone. And because of this, would like to implore you to also be a WHO collaborating center. So in over 80 member states globally, WHO is working on areas of nursing, occupational health, communicable disease, nutrition, mental health, chronic diseases, and health technologies. And these collaborating centers are designated by our DG, Dr. Tedros, and they really support countries to perform research, to provide training, to offer other services in furthering the health agenda. And after these 5 successful years of the MOU we've had, I think we have a compelling case to put School of Public Health forward as a collaborating center for the WHO. Distinguished ladies and gentlemen, as we celebrate the achievements over the past 70 years, we must look to the future. I think this has really been buttressed, but allow me to stress it further. And we congratulate you on the new strategic plan, because really the challenges for the 21st century, they're becoming quite something, ranging from communicable disease to mental health challenges to climate change. And congratulations on the sustainable health school. That's really going to go a long way. But just to recommit WHO's position, it remains resolute. We'll continue to support the School of Public Health to ensure that future public health professionals are equipped with knowledge, with skill, with resources required to tackle the complex health challenges that lie ahead. And as we look ahead, we are inspired by the next generation of public health professionals who are being educated here. The students who will graduate in years to come will carry the responsibility to build on the incredible legacy which Professor Owire elaborated quite articulately. And we have no doubt that these graduates will continue to be leaders in shaping the future of global health. So allow me to extend my very heartfelt congratulations, and I'm also part of the alumnus of Makerere University, by extension School of Public Health, to the leadership, to the faculty, to the students of Makerere School of Public Health. Your work, your dedication, they've made a tremendous impact on health and the well-being of Ugandans and beyond. And we celebrate not just the past 70 years of excellence, but the future that we continue to build through your unwavering commitment to public health. On behalf of the World Health Organization, I express our deepest gratitude for your contributions, and we look forward to continuing this invaluable partnership in the years ahead. We pledge our support to continue working with the school, offering our technical expertise, offering our knowledge, and of course bringing global best practice. Congratulations again, and thank you.
Thank you very much to all our partners for their remarks. And now, a bit about our strategic plan that the Dean already told you to scan the code. Hopefully you have a copy already. But to tell us a bit about the journey in developing that strategic plan, I'd like to invite our colleague, Dr. David Musoke, a senior lecturer at the School of Public Health, who has led this effort. So welcome, David.
Thank you very much, Phyllis. I will stand on the protocol that has been given earlier in the interest of time. But my task is really simple, to give you an overview of the process we've undertaken as a School of Public Health to develop the strategic plan that is to be launched this afternoon. As some of you may know, the school has had a plan that was a 10-year strategy, that is 2020 to 2030. But to align with other existing university strategies, it was felt necessary to have a review of our performance over the past 5 years and also develop a new plan so that could guide us as we continue in this journey. So we had a committee at the School of Public Health, including other members of the fraternity. My colleagues are Dr. Richard Mugambe, Dr. Alozia Senyonjo, we had Dr. Justin Bukenya, as well as Dr. Victoria Nankabirwa, who worked closely with a consultant and his team, that is Dr. Wilberforce Tuliasingura, to really steer the process of developing this particular document. So as part of the process, we were tasked to first of all carry out a review of our performance over the past 5 years to take stock of our achievements and challenges, and that would again lay a platform to inform our strategic plan for the next 5 years. So the process was quite engaging and long, engaging several internal stakeholders within the school, so departments and several units, as well as beyond the school. We engaged the leadership of the College of Health Sciences, as well as the university management and other internal stakeholders. Beyond the school, we were also able to engage several other partners, including the Ministry of Health, but also several district local governments, as you heard, who have been our partners for several years. We also engaged several other local and international stakeholders who we felt were really important in the process. So with all this evidence we gathered, we knew it would inform our performance, but also we got ideas from these stakeholders on how they thought the school should look in the next 5 years, and all this evidence was synthesized and shared in a report to the school board, which school board later on approved the strategic plan, which of course we are going to launch this particular afternoon. I wish to thank in a special way Professor David Serwada in his absence for really supporting the team, but also the Dean, Professor Dawanyize, for being a very big part of this particular journey. I know that we have a few copies of the strategic plan, so I would really encourage many of you to get yourselves copies so you can see the journey that we hope to take and the vision and the direction as we start the next 5 years as a standalone school. Thank you very much.
Thank you very much, Dr. David Musoke. To Brenda and the people doing all the hard work, if there are more hard copies of the strategic plan, please pass them around. Otherwise, on the screen, I've been asked to put back the QR code for people whose phones can pull it from wherever they are. They can scan the QR code for the strategic plan. Brenda, you're distributing some of them? No? Something else? Okay. In terms of the strategic plan, that is all for now. Please scan the QR code, and we will keep telling you, as we have in all meetings with our partners, updated you on our strategic plan. Good, it's there. Let me request the Chair Council to come and welcome our chief guest to give her remarks. Thank you very much.
It's indeed a great honor to invite my sister, the chief guest, the Honorable Margaret Muhanga, to come and address the congregation. Welcome, Honorable.
Good evening, dear participants. Please allow me stand on the protocol already established by the many speakers that have been here in the interest of time. I'm really honored to be here at the School of Public Health because as Minister for PHC, I think the Deputy Speaker couldn't have said another person, because these are matters that are really passionate to my heart. And I'm happy I'm celebrating the Platinum Jubilee with you this evening. This School of Public Health has been a driving force in public health education, research, innovation, and even service delivery. From influencing health policy through cutting-edge research to training health professionals who now hold leadership positions worldwide, all trained here at our School of Public Health. This leaves really an indelible ink, because you've got a lot of alumni that I know who have even done this right from the humanities but coming to do public health as a passion. I'm aware of some of the excellent work that the school has done to advance very critical areas of health. The school has actively engaged in stakeholders, including members of parliament. These stakeholder meetings have included members of parliament, and I've attended some of their work through the parliamentary network on communicable diseases and many other networks, especially on road accidents and such things that concern health, water provision of clean water and sanitation. I've been involved in this for quite a long time. During critical times such as COVID-19 pandemic, the Ebola outbreak, the School of Health, Public Health here stood out as a beacon of knowledge and made significant contribution to the national response. Its evidence-based recommendations and community health outreach saves lives and strengthens the health systems. This is a legacy built on dedication, excellence, and collaboration. Please keep it up. I thank the School of Public Health for stepping in or stepping out and engaging communities and various stakeholders to ensure that the knowledge that they generate is actually translated into societal impacts. And as you are aware, the Deputy Speaker has also been a member of the University Council, and so where this university falls, and I'm sure he also gave you good counsel. I believe in Uganda, where we are at, we need access to quality health care, regardless of location or social status. Everybody deserves good health. And to this end, I'd like to say a few things that we need to look at. Personal commitments to public health. I want to advocate for malaria eradication through the use of very many other things rather than just a mosquito net. But I would like to say even the reintroduction of DDT is crucial at this time. Because I understand many places in Asia ended malaria by using DDT. We need to promote and prevent diseases by promoting health promotion and wellness. We also need accountability, and transparency in our health systems programs. We need also supportive research, innovation, and capacity building among our human resource. We need also to tap into the climate change and health preparedness, which is already in our system, and in the Ministry of Health we do have a commissioner in charge of environmental health. The 2025 to 2030 strategic plan, which we are supposed to launch now, and which I take this honor to officiate at the launch as well. This is a forward-thinking document that seeks to elevate public health, education, research, and service delivery to the next level. This plan is a roadmap for tackling emergency public health challenges and creating sustainable community-driven solutions. And now we need to focus. What are our key focus points? Health system strengthening, research and innovation, climate change and health, equity and social justice in health, non-communicable disease control. When I talk to people in many of these forums I go for, I always tell them that it's better to prevent diseases than wait for them to reach us. And as a ministry, we take cognizance of the fact that 75% of our disease burden is preventable. And so we just need to up our game in preventative measures than curative ones. So preventive measures are the solution to all these diseases that are preventable. Even accidents are preventable. HIV, AIDS is preventable. If you can be careful, you may not get it. So as we celebrate these 70 years of public health excellence, I extend my deepest congratulations to Makerere University School of Public Health. Your vision, your resilience, and hard work has built a foundation that inspires hope for a healthier and more equitable Uganda. Let us all rise to the challenge of making the 70 years impactful. And now the next 30 years, as we go to celebrate 100 years, we must together get a future where health is not only a privilege. Thank you for your kind attention, and may God bless you.
I'd like to invite our Dean to please accompany your guests to sign this dummy strategic plan, as well as our chief guest.
Thank you. Thank you, Phyllis. Would like to invite our guests at the front here, our chair, our vice chancellor, the deputy vice chancellor, the deputy chief of mission, to come and join us up front to launch our next journey, starting next year as a stand-alone school.
Our principal.
A lot of things falling in place, that we are looking back and starting a new journey.
Our principal.
Starting a new journey in January 2025 with a brand new strategic plan witnessed by our key partners. Director General, please come and join us. We cannot implement this without you, and we need you up front.
Today's what, 12 or 13? 13.
I just want to say I take this honor to launch Strategic Plan 2025 to 2030, and the theme is sharing health, empowering the future. Shaping health, empowering the future. Let's empower the future. Thank you very much.
Thank you very much, Honorable Margaret Muhanga. I would like to invite our former deans and directors to come and join us to sign as well. They're asking me to. Kindly stay up front. We are going to take a picture after signing. No, she's not able to come, unfortunately. Yes, please. Yes, we will. Professor Namboze, we will reach you where you are. Professor Stefan, please come and join this picture to represent our partner, Karolinska Institute. Dr. Daniel Chabainza.
Could we have some smiles for the next 70 years? Yes, at least that is beautiful. It's a happy day, happy moment. The launch of Makerere University School of Public Health Strategic Plan 2025 to 2030. Shaping health, empowering the future. Yes, congratulations.
The photographer said the queue is too long, but I would like to make a special request that we have a different outlook to this so that we can have the rest of our team at the School of Public Health join. The heads of departments, please, Dr. Susan Chiwanka, Esther, Elizabeth, please do come and join, even if we have to make a second queue. Or make some shifts. This is our plan. We need to have you here. And Dr. David Msoke and the team. We missed you, Professor Awire. David Msoke, Alozia Senyonjo, and team. I would like to request that you come and join this picture. Even if we have to make two lines of this, the photographers would need to arrange us somehow, but we need to have you in this picture as well. And then we are going to have, after this, if we will request the chief guest to issue the certificates to our district partners.
You want to make a second line?
Are you able to pick all of us now?
I think if it came a bit forward, some people could stand down here. Then, well.
Prof, can we see you? I'll move behind.
Okay, that's better.
Amos decided not to come.
We're coming to the end, an award of certificates, cutting the cake outside, so really, we are coming to the end of the event.
Thank you so much. Honorable Minister, we request you to hand over. Honorable Minister, we request you to hand over our appreciation certificates to partners from the district who support our training, our public health schools without walls. Chair Council, please come and join to recognize our critical partners who have supported our training programs for decades. Some of these districts have hosted students for more than 20 years since we started the program.
Okay, thank you. Dr. Timothy Mwange, if you're around, please step forward. Dr. Wakoba Peter, if you're around, please come forward. Dr. Lugolobi Matthias, if you're around, please come forward. Dr. Wilbrod Mwanje, Dr. Isa Makumbi, Miss Flavia Chomkama, Dr. James Kisambu, Dr. Sarah Bwachika,
Oh. Who is that?
Dr. Isa Makumbi. Dr. Sarah Bwachika, Dr. Okumu David Cyrus, Dr. James Kafero, Mr. Timothy Lubanga, Dr. Stavia Turahave, Dr. Timothy is here. Dr. Matthias Tumeraze, Dr. James Kafero.
It's already there.
Maybe we shall just have a standing ovation for this DHO who has just passed on. He just passed on recently when we were going to recognize him, Dr. Paul Jeleba from Arua. Dr. Tumweras. For a moment of silence for Dr. Paul Bishop Jeleba, who just passed on recently and has been a great supervisor and mentor to our students, DHO Arua. May his soul rest in eternal peace. Dr. Ochen Buchan, Dr. Mugahi Richard, Yes, you can receive for Dr. Mugahi. Thank you. Dr. Alan Morita. Dr. Buchan. Dr. John Omangino. Dr. Diogo Nantamo. This one is around. Yes, he's coming, I think. It's a he. Yes, Dr. Lubega Suleiman.
So why don't you wait for Nantam?
I'm hoping.
That's Nantam.
I'm hoping it's here. Yes, this is Dr. Yes. Dr. Walomio Richard Walex, Dr. Simon Chaze, and Dr. Peter Waiswa.